Hi, Mr. Lovell. My name is Julie. I'll be your nurse today.
Hi, Julie.
I hear that the doctor would like you to start taking your blood pressure at home every day.
Yeah.
Okay. So what I'm going to be doing today is I'm going to take your blood pressure using my manual stethoscope and blood pressure cuff. It's a little difficult for you to do that by yourself at home. So what I'm going to do is take your blood pressure with the automatic machine, and I'm going to show you how to do that, and then I'm going to have you teach back how to do your blood pressure at home. All right?
All right.
Okay. So one of the first things that you want to do is sit down in a chair, be nice and calm. You don't want to have any alcohol in your system or caffeine. You don't want to have exercise throughout the day. You want to sit down, nice and calm for 5 minutes in a chair. Deep breathe, try to relax, because stress, anxiety can all make your blood pressure higher than it actually is. So I'm going to have you sit in the chair for 5 minutes, and then I'll be back to take your blood pressure. 5 minutes later. Okay, so I'm going to start with this. What is your blood pressure normally? What have you been getting?
Like 115/70.
It's actually only even numbers, so.
120/70.
Okay, 120/70. Okay, so we want to keep that healthy blood pressure going, so that's probably why your doctor's like trying to teach you how to maintain that, so that's great. And I'm going to take it with this first. Arm in here, please. So we're going to have your arm like this, rested on a table, about heart level. So this is perfect at home when you're doing this. This is a great level. Okay, put that around there. How's that feel? Okay. Great, about 118/68. Okay. So now I'm going to have you actually turn your chair, put your left arm up on here so we can do the other arm, okay?
Yep.
Have you ever used one of these machines before?
No, ma'am.
Okay, so they're super simple. This one is just a one-button one. Do you have one at home by chance?
I can get one.
You can get one? Okay, I think they're really cheap on Amazon. So after you leave today, you'll want to order one of those so you'll have it every day. Right hand or left hand up here. Okay, there's a mark right here. Hold on. Sorry. Other way. Okay, this is your artery. Your artery is going to be right in here. So we'll just keep that right about there. You want this not too tight, so you can still get a couple fingers in there, okay?
Mm-hmm.
All right, so we'll have you wait 5 minutes, rest, 5 minutes go by, and all you're gonna do is push start. Try to keep relaxed, feet flat on the floor. Just push start. You don't think about your blood pressure at the time. You don't have to watch the numbers. Just think about your 8 cats you have at home. Petting cats lowers blood pressure. Did you know that?
Oh, I didn't. Maybe that's why my blood pressure is so low.
Mm-hmm.
Okay.
All right, 120/64. All right?
All right.
Okay. So now I'm going to push stop, take this off of you, and then I am going to have you do this on your own arm. Okay? So So I'm going to give this to you and I'm going to correct you if you do anything wrong. Let's try it on that arm this time, okay?
So I'll go this way. Put the artery mark right about
Perfect.
where the artery is.
Yep.
I'm gonna put this on not too tight,
Mm-hmm.
but get it on so that I can get 2 fingers underneath there, like
Yep.
you were saying.
Plenty,
Right
good.
there.
Mm-hmm.
And then feet flat on the floor.
Yes.
Hit the start button.
Anything else you want to remember in the morning?
No exercise, no eating, drinking coffee. Just try to sit in a chair for about 5 minutes
Correct.
and then do this routine.
Absolutely. Okay, 118/67. That's excellent, and we want to keep your blood pressure within that range, okay? Do you have any questions that you would like to ask me about taking your blood pressure at home?
No, it's just pretty straightforward. You did
Okay.
a great job explaining it.
All right, excellent. Thank you, David.